Hello, my name is Kaden Bratcher, and I am doing a video for my psychology class in order to discuss the 5 discussion questions that was posted before our discussion board. Right now I'm addressing the video that addresses mental health, stigma, and understanding all of it. Now, the 5 questions are: what is psychopathology? The second one is from your notes. What are the 5 criteria used to classify abnormal behavior? What exhaustive resources used by psychologists and psychiatrists to categorize and diagnose mental health disorders? Is depression more prevalent in women or men? Why do you think it's true? And are young adults and adolescents at higher risk for an eating disorder? Now, for my first question, psychopathology is the scientific study of mental disorders, including their symptoms, causes, and treatments. In the video, Sangudel talks about how he struggled with anxiety but didn't want to admit it because of the stigma. And that's exactly why psychopathology is important. It helps us understand and normalize these conditions instead of ignoring them. For the next question, it was asking what are the 5 criteria used to classify abnormal behavior, and the first one is the thinking or behavior unusual. The second one, does the thinking or behavior go against social norms? Does the behavior or psychological function cause the person significant subjective discomfort? Is the thought process or behavior maladaptive, or does it result in inability to function? And does the thought process or behavior cause the person to be dangerous to themselves or others? Now, I believe in the TED Talk it connects because Sango mentions how society can label mental struggles as weaknesses or abnormal. Even when people are simply going through discomfort or stress, that shows how cultural norms play a role in how we view mental health. Number question 3. What exhaustive resources is used by psychologists, psychiatrists to categorize and diagnose mental health disorders? That would be DSM-5, which stands for Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It's basically the handbook that professionals use to diagnose conditions. This matters because, like Sangu said, if we don't talk about mental health or have a structured way to diagnose it, people suffer in silence instead of getting help. Now, is depression more prevalent in women or men? Depression is more prevalent in women. Some reasons include biological factors like hormonal changes and also social stressors. But Sango's story reminds us that men often face stigma around seeking help, which can make their depression harder to recognize. So while women are more often diagnosed, men may experience it at higher levels than reported. So they basically stay quiet because we don't want to be judged. But for question 5, finally, are young adults and adolescents at higher risk for eating disorders? Yes, they are. Young people are especially vulnerable because they're still developing their identity and they're under constant pressure from their friends and, all about their body image. But that ties in the video because stigma and social pressure doesn't just affect mental health like anxiety or depression. Like, they also affect things like eating disorders. When people feel they can't open up about their struggles, it makes the problems worse. So that's about all the questions for today. Song of Dust TED Talk really reminded me that mental health is human health, and there's absolutely no shame in asking for help at all. So thank you for watching, and